Dr. Vikki Petersen here. I want to speak with you today about our children and some of the causes of death of children under the age of 5. The second most common cause is diarrhea. Diarrhea-related death in children under the age of 5 is actually very, very common. It's more common in our developing nations than industrialized nations, but it's still a factor here. The reason this ties into the topic that I frequently talk about, which is gluten intolerance, is that gluten creates diarrhea in people affected, especially with celiac disease. And children who develop the symptoms of celiac disease early in life, diarrhea is definitely a major symptom associated with that. So how this ties together, and excuse me while I look at some of my statistics here as my eyes glance down. Now, most deaths associated with diarrhea, especially in developing nations, come from waterborne infections. So these are countries where hygiene is not up to the standards it should be, and these waterborne pathogens create diarrhea, and this can lead to death in children. So that is the majority of the time, that is the cause. However, in 2010, it's estimated that worldwide 2.2 million children around the world will have celiac disease, and 42,000 deaths will be caused in a year for children under the age of 5 as a result of diarrhea. So that's 42,000 children dying because they have diarrhea due to celiac disease, so not due to those waterborne infections that we talked about earlier. So the problem here is that in developing nations, some of the treatments for diarrhea that's considered to be diet related, so in other words, they rule out the waterborne pathogens. The common dietary practices include gluten. So as we do better and better with sanitation, which a number of wonderful people are working worldwide to improve this, and the deaths associated with poor sanitation and these waterborne pathogens are going down each year, so that's terrific. But what happens is that remainder that's not due to that, and that's dietary, and especially celiac, the treatment, what they use as far as nutrition and food are gluten containing supplements and gluten containing foods. So what is estimated is that the problem with children dying from diarrhea due to celiac disease or gluten intolerance is going to keep escalating because no one's looking at this aspect of things. Okay, so they're looking at just malnutrition and, as I mentioned, the poor sanitation, but in the malnutrition area, what they tend to put in the diet is gluten, especially in the form of wheat. So this is an awareness. I mean, I'm always talking about increasing awareness in the U.S., and obviously I'm here in the U.S., so I'm thinking more industrialized nations, but this particular study really hit me, not only because it does affect us here in industrialized nations, but it really affects us globally. And the internet is a beautiful thing because it really levels the playing field of communication. People are on the internet from literally, of course, all over the world, and I receive emails from people all over the world. And the more we talk about this, the more the awareness rises, and we can literally be saving lives of these children because the people that are looking at helping them start adding gluten intolerance and celiac disease to their little checklist of what can be wrong with these children. So I share this with you today so that you can share it with others, and we can really increase awareness and make a difference in children's lives everywhere. I hope you found this helpful, and until next time, I wish you very good health.